financial management, operations management, and compliance. She has worked for the Foundation for Professional Development Evaluation Unit for 6 years and was responsible for evaluating various health sector programs which were either funded by donors or government. Alette completed her higher education diploma in 1995 and has been involved in facilitating, assessing, and moderation throughout her professional career. I'm proud to say I've known Alette for the better part of my professional life within FPD. And she has been working as an independent consultant since 2020 in October. Welcome, Alette.
Thank you, Eligibility. Thank you for having me.
Alette, we are going to touch on an important topic today, which is very familiar to you, and I know it's close to your heart, which is the Masters in Public Health, which is the public health field, which is something that I know you are very passionate about.
Yes.
Can you tell us why is a Master of Public Health important?
Yes, Eligibility. And I'm so excited about this. I've seen the whole, and I want to call it a evolution and revolution in public health from where we were at a point at the end of the last century where we had no funded treatment for public sector patients for HIV, where we moved through an era of age denialism until the point where we had treatment for everybody. And we are now, you all know, we are working on viral suppression. We are trying to work towards the 95 targets, which is amazing. And the healthcare sector is one of the few industries where experts expect a substantial increase in the number of jobs. Even in South Africa, we don't have enough people working in the health sector. A Master of Public Health degree holds the promise to the holder of that qualification to promise job security, exciting new employment opportunities, and also the opportunity to make a real difference in people's access to good health. A Master of Public Health can go in various directions. You can focus on the development of policy and legislation. You can work in education. We need good educators. And there you can educate either people or businesses on how to go about ensuring good, proper health. You can also track diseases and identify how diseases spread. Or you can do research. The bottom line of this is we want to help people and improve their health if we work in public health, and if you hold a Master of Public Health, you can help to do that.
Very much, Alette. That is actually quite informative. It's actually mind-boggling how wide the scope of the Master of Public Health degree actually covers. I mean, I never thought you could actually go into education with a Master of Public Health. You know, you think public health and you tend to think, okay, research, evaluation, things like that. But thank you for that information. But what can you do once you have obtained the qualification, the Master of Public Health?
There are various areas where you can focus. You can focus on the administration side, where you can ensure policies and procedures. You ensure that the policies and procedures are there, that they are clear, that they are accurate, that they are being implemented. You can work in analyzing the data that you have. And that you can do as either a researcher or an epidemiologist or even a forensic investigator, where you track where an outbreak started. And a lot of people like to do this. We have 1 or 2 experts also on the team at FPD who works on that. Or you can work on determining where a public health threat is coming from, Or you can evaluate the current data and trends to see what patterns are there and how you can prevent future outbreaks from starting. Then you can also look at the clinical side. A lot of people think Master of Public Health is just about the clinical side, and that is really very important. People with a clinical background who also hold a Master of Public Health are very much in demand in laboratories, in hospitals, and in other health facilities. Then you can also work in the community. We need a lot of community involvement. We have seen through the AIDS denialism era what the value of civil society and activating the civil society is. And there you can work, if you work in the community, you can work around activism, preparedness, and environmental health, just to name a few of the opportunities that are available. In education, you can work as a lecturer or a facilitator. You can work in the health industry to also educate organizations and individuals linked to those organizations. Or you can work in an organization as a staff internal resource to help that organization to set up all the health priorities that they need to look at. Food safety is a very important topic at this stage. There you can focus on local, national, and even international food supply chains and ensuring that people have enough food and enough healthy food that is provided to them. Political science is a very nice topic for a lot of people, and there you can use the evidence to influence policy change and implement new best practices coming out of evaluations and research. Some people go into serving specific demographics where they help large proportions of the community who are at risk. We focus a lot on key populations, and that is an area that needs a lot more work, and we need a lot more people on the ground there.
Thank you very much, Alette. I think at this point in time, the obvious question is who should enroll or can enroll for a master's in public health? Can you enlighten us on that?
Yes, anybody can enroll. Any individual interested in the different aspects of health-related research or service delivery. I, for instance, started from a finance background, as you've heard from my bio, and I moved into monitoring and evaluation and education. So it is very possible for anybody. We have students with an HR background, an IT background, who are involved and enrolled on the FPD Master of Public Health. Health professions, healthcare managers. Oh boy, we need healthcare managers with Master of Public Health degrees because they have the influence to implement best practices in their facilities and in their districts and in their provinces. So that is important. So if you are a health professional or a healthcare manager and you want to broaden your skills into the area of public health, please consider enrolling for a Master of Public Health. Non-health professional graduates who are interested are also welcome to do this because you can still work in the field of public health and you can strengthen specific areas where you are going to work. So yes, if you are in finance, if you are in IT, if you are in HR, please consider enrolling.
Well, we're almost at the end of our brief interview. Can you just summarize for us the benefits of actually having a master's or a Master of Public Health qualification, Alette, so that it's just entrenched in our minds, and what is the take-home message at the end of the day?
Yes, if you enroll for a Master of Public Health, you will have increased knowledge and skills that are needed to work in the health field. And that can be the private health field or the public health field. There are different areas of speciality. I'm going to touch on some of them again. You can develop policies. You can go into biostatistical analysis, health promotion, monitoring and evaluation, environmental health. Disaster preparedness is one of the important areas that people focus on, especially after the COVID pandemic. So yes, there are a variety of jobs within different sectors, whether it's public or private, local or international organizations where you can work if you have a Master of Public Health.
Thank you so much, Alette. I mean, from what I've gathered from our conversation, having this qualification really can open any door that you put your mind to it. And it's
Definitely.
something that is important, and it's a qualification for one to have if they really want to progress within their careers. On that note, thank you very much, Alette. It has been lovely chatting to you again, and hope you enjoy your day.